Mitch McConnell and John Boehner went on 60 Minutes, and they were asked the very simple question, what's your health plan? Let's look at their answer.
What's your health plan?
Providing more access we could have done without taking control of the entire healthcare system. When you look at Obamacare, it's a perfect example of what Washington does. It's a one-size-fits-all approach for the whole country, all driven by Washington bureaucrats. I bet they've hired tens of thousands of people between the IRS and over at Health and Human Services just to run this. All the decisions, all the rules decided by Washington. We have a wide, diverse country. And I just think it's time for us to look at this differently. For those who don't have access to affordable health insurance, helping those at the bottom, I think we're all for it. But we don't need Washington to ruin the best healthcare delivery system the world's ever known.
So how do you do it? What's the Republican healthcare plan?
We're working on this, having discussions amongst our members. We got a lot of divergent views about how best to go back to a doctor-patient relationship that's revered, about rewarding medical professionals as opposed to all those rules that are coming down and frankly driving doctors out of the system.
But you know, this is one of the criticisms that a lot of Americans have, that the Republican Party knows what it's against, but can't tell us what it's for. Can't tell us the details, for example, of a health care plan after all these years of Obamacare.
Scott, with all due respect to you, you mischaracterized the likelihood of success with Obamacare. The Congressional Budget Office doesn't work for Republicans or Democrats, run by a former Clinton staffer, said that the best case scenario, Obamacare reduces the number of uninsured from 40 million to 30 million. A 2,700-page bill that wreaks havoc with the private health insurance market, and in the end, doesn't get everybody covered in the first place. Now, that is not my view of how to improve the American healthcare delivery system. If we had the ability to do it, we ought to pull it out root and branch and start over. The chances of that happening with Barack Obama of Obamacare in the White House is slim, but we're going to make the effort.
You don't have an alternative.
Why wouldn't we allow the states to run their own exchanges?
That was the plan of Obamacare. Why wouldn't we allow the states to run their own exchanges? They passed the bill that did that, but then the Supreme Court struck down that provision and made it optional, and then all the Republican governors, or to be clear, a lot of the Republican governors, said we're going to refuse to do our own healthcare exchange. What John Boehner just proposed at the end was Obamacare. That was the heart of the bill. It was the individual mandate and the separate state exchanges. What happened is all the Democratic-led states set up their exchanges, and they've been wildly successful, and a lot of red states said, thanks but no thanks, and now people are struggling in those states. When they start out by saying, Boehner starts out by saying, he goes, what are you for? Pelley says, what are you for? And Boehner goes, well, you know, we shouldn't have done Obamacare, and he goes on to pontificate on that. But notice, that's a sidestep of the question. The question is, what are you for? He couldn't give an answer. He goes right to bashing Obamacare. Now, why can't he give an answer? Because he doesn't have an answer. But even when he's criticizing Obamacare, the stuff he's saying is incorrect. He said, well, the government took control of the entire healthcare system. That's not true. In fact, Obamacare was crafted specifically so that wouldn't happen. In fact, I wish it did happen because single-payer, government-run healthcare systems are empirically the best in the world if you believe the World Health Organization study. So I wish they would have did that, but they didn't do that. What they did was a very right-wing approach to reforming the system. They mandated that individuals go buy on the private market, and they set up healthcare exchanges so you can see competitively which plan is lower than the other one. So, it's your plan. That's what they don't have an answer for. And by the way, people are saying Scott Pelley did a good job there. I don't think he did a good job. I think he did a terrible job. Because he should have brought up, now wait a second, Richard Nixon proposed what eventually became Obamacare. Bob Dole proposed what eventually became Obamacare. In the 1990s, the Heritage Foundation, a right-wing think tank, wrote policy papers about that. That's their plan. That's the counter to Clinton care. You had Chuck Grassley and Newt Gingrich and all these Republicans in the House supporting it back then. It's the old Republican plan, and then a Democrat proposes it. Now all of a sudden you guys are acting like it's a big government takeover when the whole point of it was to be not that. So why are you guys against your own plan? That's the question he should have asked, and he didn't ask that. And also, John Boehner slipped in there at one point. He said, I don't know why we ruined the best healthcare delivery system the world has ever known. Scott Pelley just let that slide. I would have been like, whoa, wait a second. I have 3 different studies here. One of them says the U.S. is 37th in the world. This one says the U.S. is 46th in the world, and you go down the list. There's a World Health Organization one from the year 2000. There's a recent one that we covered about a year and a half ago on SecularTalk that said we're about 46th in the world. There's all these different studies that talk about how, the U.S. healthcare system, we spend way more than every other modern nation, and we get worse outcomes, and 45,000 people die in the U.S. because they don't have access to basic healthcare, and 30 million people are uninsured, and the list goes on and on and on. If I was Scott Pelley, I would have been like, wait, but you're wrong about that. Your argument is, and John Boehner says it at one point there, we need to go back to a system where it's doctor, patient, yada, yada. No, there is no going back to an ideal in America because there never was an ideal in America. Our healthcare system has always been worse than the other modern nations since they put in place their single-payer systems. You have to call them out on that, but he doesn't do that. And the final thing I'll say about this real fast is that Mitch McConnell goes, well, the best case scenario is that Obamacare gives coverage to 10 million people. Yeah, my response to that would be, that's better than giving healthcare to 0 people, which is what your plan is. 10 million is better than 0. Look, I understand, and I'm the first person to make the criticisms that say that Obamacare is not perfect, and it's basically putting a Band-Aid over a deep gangrenous wound. I get that. I'm the first person to argue against Obamacare for that reason. But the problem is that any Republican counterproposal makes the system worse. So you have to hold their feet to the fire, and you have to call them out. And the Republicans, I personally think that at this point what they're doing is they're shooting themselves in the foot when they keep talking about stuff like this.